Go ahead, ma'am.
Good afternoon, everyone. Myself, Dr. Shweta Sonwalkar, Clinical Head and Fertility Specialist at Oasis Fertility, Belagavi. So, today's topic for the discussion is intrauterine insemination. In short, it is known as IUI. So, before we go into IUI and understand what is being done in IUI, let us understand how the natural conception occurs. So when the couples are trying for the pregnancy and when the natural intercourse occurs, the semen gets deposited in the vagina. This semen contains millions of sperms. Out of these millions of sperms, only some thousands of sperms are able to enter the uterine cavity. So out of these thousands of sperms, only some hundreds of sperms are able to enter the fallopian tube. So when the ovulation occurs, the oocyte, which is released from the ovary, is picked up by the fimbrial end of the fallopian tube. And this ovum stays in the fallopian tube for 24 hours. So out of these hundreds of sperms, only one sperm is able to fuse with the oocyte. And it stays in the fallopian tube for 3 days and it enters again into the uterine cavity and the implantation occurs in the cavity. So, what is IUI? It is a type of artificial insemination. Here, the sperms are placed directly into the uterus at the time of ovulation. So it is one of the simplest technique of ARTs. It is minimally invasive, simple and cost effective, and it is the first therapeutic step in the treatment of infertility. So how this IUI is different from natural conception. So in comparison to natural conception, IUI, it increases the number of motile and healthy sperms at the uterus and decreases the time and distance taken by the sperm to reach the uterus. Thus, it increases the probability of conceiving by 5 to 10% more. So, who all can benefit from IUI? There are some indications in whom IUI is beneficial, such as male factor infertility. Here, the person who has suboptimal semen abnormalities. That is, at least the person should have the sperm count of more than 10 millions with a motility percentage of more than 40%. So they benefit from IUI. Second is cervical factor infertility. Those women who have got hostile cervical mucus. That means the mucus is not a favorable condition for the sperms to penetrate through the mucus and enter the uterine cavity. So, by doing IUI, the cervical factor can be easily overcome. Next, the couples with coital issues, such as male and female sexual dysfunction, such as male dysfunction. If the person is having uh, erectile dysfunction or ejaculatory dysfunction or retrograde ejaculation, and if the female is suffering from vaginismus or vaginismus, these patients by doing IUI, it is of great benefit. Next is the immunological factors, where the vagina and the cervix has the antibodies against the sperm, and the sperms get destroyed at the level of the cervix and the vagina. So by doing IUI, these patient can benefit from the procedure. Next group of patients who comes under mild endometriosis, like grade 1 and grade 2 endometriosis. Here we are giving medications for the ovulation to occur, and the timing the ovulation with IUI is of great benefit to these patients. Next group of patients who comes under ovulatory dysfunction. For example, the patient with PCOS or obese patients in whom the ovulation is not occurring on time. So for these patients also, giving medications for ovulation to occur and timing the IUI is of great benefit. And next, doing donor sperm insemination. If the person is having very severe seminal parameters such as azoospermia, where um, uh, sperms are absent. So in such patients, donor sperms from the donor bank and doing the IUI is of great benefit. Next group of patients who comes under unexplained infertility. Here the woman is the factors for the infertility in women and for the male factor infertility are all normal, such as patient is ovulating well and the semen parameters are also normal. Bilateral fallopian tubes are also patent, but still the patient is not conceiving. So in such women also, doing IUI is of great benefit. Next group of patients, if either of the couple, if they are suffering from viral infections such as HIV or HBsAg. So these, by keeping sexual contact, they get transmitted to one another. So when we do IUI and when we wash the sample, the viral load gets to a large extent, and these patients are benefited from the IUI procedure. So before advising the couple for IUI, we need to know whether the couples are the right candidates for IUI or not. So there are some prerequisites for IUI, such as the age of the patient should be less than 36 years. The patient should be capable of spontaneous or induced ovulation, and at least one of the fallopian tube should have good tubo-ovarian relationship, and a sperm count of at least more than 10 millions per ml, or with a motility of at least 20%, and easy access to the uterine cavity via a negotiable cervical canal. So patient workup is done by doing baseline transvaginal scan to know whether ovarian reserve of the patient, that is antral follicle count in both the ovaries. Next, tubal patency is checked with the help of hysterosalpingography or sonosalpingography. Next, hormonal evaluations are done on day 2 of the menstrual cycle, such as TSH, prolactin, FSH, and AMH, where AMH becomes more beneficial. Then detailed seminal analysis is done to know the number of motile sperms, its morphology. Then uterine assessment is done by doing ultrasonography to rule out any uterine pathologies like fibroid uterus, adenomyosis, endometrial polyp, or septal or any septate uterus. So once the patient is labeled for IUI, we call the patient on second day of the menstrual cycle to start the treatment. So from second day or third day of the menstrual cycle, we are giving medications, or even for some patients, we are starting injections so that the ovaries can produce good follicles. Once the follicle reaches a dominant in size, we are giving the injection so that ovulation happens. So on the day of IUI, IUI is planned 36 to 40 hours after the injection. So on the day of IUI, we are preparing the semen by using the density gradient method. That is, density gradient media is placed in the test tube and the semen is layered over the density media, and it is centrifuged. After the centrifugation, the motile sperms we get at the bottom of the test tube. These motile sperms we are collecting and we are loading it in the IUI catheter. And the patient is asked to lie down on the examination table. Speculum is introduced under aseptic precautions and under ultrasound guidance. IUI catheter is introduced inside the uterine cavity and the sample is pushed slowly inside the uterine cavity. And after the procedure, patient is asked to lie down for 15 to 20 minutes and later on she can go back to her work. So post procedure, we are giving some medications and after 15 days, we are calling the patient for pregnancy checkup. Now, what are the side effects of IUI? Patient might have slight mild abdominal pain, so which might be there for at least 1 to 2 hours and it doesn't need any medications. And slight bleeding or spotting will be present because of handling of the cervix. Then soreness of the breast, nausea, and mood swings are present because of hormonal changes. Now, what is the success rate of IUI? Success rate of IUI is 18 to 20%, but still it varies from couple to couple. And it also depends upon the age of the patient. Then what are reasons for infertility? Then semen parameters. As the age advances, the percentage of IUI success rate comes down to 5% at the age of 39 to 40. So, what are the commonly asked questions after the IUI? Sometimes patient asks whether the IUI is painful. Slight pain will be present, but it is of it doesn't need any medications and it will subside within 1 to 2 hours. And the patient will ask whether she wants to take a rest after IUI. Whatever rest she is taking in the hospital for 15 to 20 minutes is sufficient and it doesn't need treatment, it doesn't need any rest for the whole day. So again, she can go back to her work or she can go back to her house and she can do her day-to-day activities. Next, regarding traveling, so even she can travel back to her house. Then regarding the intercourse, even after IUI, if they keep contact daily for at least 3 to 4 days, it will increase the chances of IUI percentage. Then regarding exercises, she can do mild to moderate exercises, but avoid strenuous exercise and swimming. Then regarding medications, whatever the prescribed medications are there, she has to take, but over-the-counter medications are avoided. So what are the possible risks of IUI? Ovarian hyperstimulation syndrome, known as in short it is OHSS. It is seen when more number of follicles are produced when we are stimulating the ovary, but it is very rare with the IUI. Next is multiple pregnancy, twins or triplets. Then ectopic pregnancy. Ectopic pregnancy means if the pregnancy occurs outside the uterus, it is known as ectopic pregnancy. If the pregnancy takes place in the fallopian tube, it is known as tubal pregnancy. As such, IUI doesn't cause tubal pregnancy. If the tubes are unhealthy, even the tubal pregnancy is more common with natural cycles. Then chances of infection. Infection as such is very less because as we are taking all precautionary measures to reduce the infection rate. So one can ask how many times can IUI be done before IVF. So IUI should not be done for more than 6 cycles. If the age is less than 35 years, if the ovarian reserve is good and semen report is also normal, then one can go for 3 to 6 cycles of IUI. then IUI chances of getting pregnancy are 10 to 15% in one cycle, but the same is 45 to 50% with IVF in women of age less than 35 years. After 35 years, maximum 3 cycles can be done. So, what are the factors which affect IUI outcome? So, IUI outcome is multifactorial. It depends upon age of both the partners, whether they are below 35 years or more than 35 years. Then duration of infertility, for example, less than 5 years of married life and more than 5 years. Then causes of infertility. There are many causes for infertility. We have to rule out and decide whether the patient can go for IUI or IVF. Then again, it depends upon semen parameters, whether the semen has suboptimal sperms or azoospermia. And depending upon the semen parameters, again, we advise whether the patient has to go for IUI or IVF. Then if the patient has taken any previous treatments and any previous IUI failures. Thank you. I am free to answer any questions. Any questions? I am free to answer.